Understanding risks on health is crucial for the future well-being of people. However, information on risks, uncertainty, and risk factors are difficult to communicate. How health professionals and authorities communicate and come into dialogue about health risks with patients and the public becomes crucial in order to prevent diseases and promote health. Risk communication in health settings is a very well-established and recognized field which is considered essential in public health. Actually, an enormous responsibility is placed on communication since it plays an important role in disseminating information that may prevent risky behaviors. Risk communication is strongly influenced by risk perception. Talking about health-related risks may seem like threatening. Even health professionals sometimes have difficulties and anxiety with risk concepts and how to communicate them. Let's start first with this field of interpersonal communication of risks about health. Effective clinician and patient interpersonal communication is associated with positive health outcomes such as symptom resolution, improved general health, as well as with greater user satisfaction in healthcare services. The operational definition of interpersonal communication in healthcare stands for the ability of the provider to produce and understand patient concerns, to explain healthcare issues, and to engage in shared decision-making if desired. This is a relevant field in healthcare settings. For example, most complaints by the public about health services are not about competencies, but about communication. The majority of malpractice allegations arise from communication mistakes. Health professionals are here the main responsible actors in the interpersonal communication process. So they need to know how to communicate about health in ways that build relationships and engage patients for well-informed decisions and behavior change to healthier lifestyles. Here, it is important to follow an effective interpersonal communication process to organize and convey information and feelings for strengthening these interpersonal interactions and avoiding misunderstandings or conflicts. In addition, this is very much related to patient or person-centered care, which is about treating a person receiving health care with respect and involving them in all decisions about their health. In relation to this, studies show that when sensitive conditions arise where effective communication is most necessary, health professionals very often try to avoid these situations instead of using their skills to communicate and to handle such circumstances. There are many strategies that are considered to be important in promoting effective communication in healthcare settings. As we can see in this figure, aspects such as empathy, tell the truth, slow down, and keep it simple are critical in clinician-patient communication. For effective communication, clinicians must be open to dialogue with their patients and provide help and reasonable responses to the important questions made by them. Health professionals need to search for realistic and accurate discussions about issues such as emotions, treatment choices, and potential clinical outcomes. For example, questions targeting people suffering from cancer might include: how should the patient cope with anxiety or low self-esteem? How will therapeutic interventions influence the quality of life? What's the average survival time for the specific type of cancer? Some patients prefer not to ask these kind of questions because they prefer not to know the reality. In this case, clinicians should search for dialogue and conversation with opening questions, such as, tell me what's on your mind, or do you have any questions? This type of open dialogue could help patients and their caregivers make better informed health decisions. Indeed, communication is essential because poor knowledge about health is associated with high rates of hospitalization and reduced preventive practices. So the promotion of health education and communication is for better access and use of health care services and well-being. In interpersonal healthcare communication, we should acknowledge some important existing barriers that may cause negative effects to health outcomes. This figure here represents a number of barriers which may be experienced. For example, patients suffering from mental health conditions might have some difficulties in understanding the messages of the healthcare provider due to the medication effects. Let me describe now some specific cases where effective interpersonal is essential in healthcare settings. For example, in relation to obesity, we have already described in a previous lecture that some of the main risk factors that produce high mortality rates are drivers of obesity, such as physical inactivity and unhealthy food. Obesity is an important risk for chronic conditions, such as diabetes, cardiovascular diseases, and some types of cancer. Although it is very needed to discuss obesity with patients to promote health and well-being, many clinicians are often uncomfortable communicating the need for weight loss to their patients. In fact, a study found that only 42% of overweight patients were advised by their general practitioners to lose weight. According to the end of life, discussions regarding death and terminal illness are also a difficult challenge for patients, family members, and also health professionals who are trying to protect their patients from bad news. So, end-of-life discussions are often avoided. Health professionals have reported a lack of knowledge and skills in effective communication about terminal illness, and these situations are found to be difficult and uncomfortable. Therefore, training in this field is urgent among healthcare professionals. In fact, a study that assessed perceptions from health students with formal training in communicating terminal illness found that these students were more confident in addressing these sensitive issues with patients. Another example, in relation to mental health, we find that violence, confusion, suicide, and self-harming are behaviors that are common in mental illness, which health professionals have reported as challenging to communicate about with patients. The negative stigma associated with mental illness appears to be a major barrier to effective communication and treatment for this group of population. One of the most important interventions for improving interpersonal communication in healthcare settings is based on training. Many studies have found that skills training for healthcare professionals is effective in improving communication with patients. And before we finish this part, we need to recall that there are some other important areas in the field of interpersonal communication in healthcare settings, such as communication among healthcare professionals in the team, which is essential to provide an effective and well-coordinated healthcare service to patients. Now we are going to explore the role of the media in the communication of health risks. The media, such as newspapers, magazines, radio, and television, both traditional or digital ones, are often criticized for inaccurate and biased health-related reporting in many countries. However, they remain the most influential source of information for everyday information on health risks. As most people do not have any direct contact with science or scientists, the media are crucial in keeping the public informed about scientific issues, especially as they are the only source about health and science for many people. The media frequently aims to cover newsworthy big events. In relation to health, journalists normally search sensational topics such as scientific accidents, great research discoveries, epidemics of infectious diseases, and safety concerns in new medicines. However, very little media coverage is given to the most frequent risks, such as secondhand smoking or poor physical activity. The effects of the media in the population are well known, and they have been investigated in relation to beliefs and behavior change. The mass media do have a powerful influence on people's perception of risks. For example, previous studies have shown that the beliefs held by a person about medicines or drugs play an important role in decisions making. Therefore, the media must take responsibility for providing correct information and building understanding among citizens. Here, journalists have an important role and should acknowledge that their strong but inaccurate and misleading headlines may increase unnecessary worries and fears among the public and reduce the effect of preventive measures, for example, during an outbreak. So, effective communication of health-related topics in the media is also needed. This will not only contribute to declining the risk of inappropriate behavior, for example, unnecessary visits to healthcare facilities, but also help eliminate fake news and misleading information, which is a serious issue in our current society due to the extensive use of the social media and the fast spreading of this type of information. The extensive spread of the COVID-19 epidemic has brought general awareness about the problems that mis- or disinformation can pose in society. For example, through fake news, there were cases of racism in many countries where there is a great panic and unwelcoming sentiment, first towards Chinese citizens and eventually towards Europeans when the epidemic moved to other continents. This is a so significant problem that international administrations, such as the World Health Organization, have coined the new term of infodemic to promote healthy behaviors and mitigate the harm from misleading information. They say that today we don't have only to fight against infectious outbreaks or chronic diseases, but also against mis- and disinformation. So now let's explore the concept of effective communication campaigns. Traditional campaigns looked at aspects such as knowledge, attitudes, and their effects in behavior. Recently, communication campaigns to prevent health risks have also looked at other important factors, such as self-efficacy and outcome expectancy. Self-efficacy is defined as the degree of confidence that an individual shows in his or her ability to engage in healthy or risk-preventive practices. For example, in the prevention of HIV/AIDS, self-efficacy is represented in the individual ability in obtaining and using condoms, as well as negotiating the use with his or her partner. In relation to outcome expectancy, this is defined as the consequences expected from using or not using a healthy or risk-preventive practice. For example, in HIV/AIDS campaigns, it is related to condom use during sex. Research has shown how these two factors are useful predictors of behavior change. In our example, the behavior change would be based on consistent use of condoms. Therefore, communication campaigns may also focus on these other factors. Other important aspects in effective communication campaigns are as follows: the use of accurate, complete, and current information, build trust between the recipient and the sender, promote self-respect and empowerment, take a participatory approach, and use adapted language and visual elements during communication. Let me now present a successful campaign. Many countries, such as Canada or the United States, have launched specific campaigns to reduce sudden infant death syndrome, or SIDS, also known as crib death. Research shows that when infants are placed to sleep on their stomachs, the risk of dying from SIDS increases significantly. These campaigns try to educate parents, family members, child caregivers, and health professionals about ways to reduce this risk, particularly the importance of putting infants to sleep on their backs. Campaigning messages were disseminated through the different types of media. For example, in the US, evaluation research showed how the percentage of children placed to sleep on their stomach decreased from 70% to 11%, and the incidence rate of SIDS death dropped from 1.2 to 0.5 deaths per 1,000 live births during the same period. Many consider the reduction of SIDS rate a great public health achievement. There are some two important components that make this to be a success campaign. First, the new behavior is easy to be accomplished, as placing the child in a different position is something simple without extra cost or inconvenience. Second, the behavior is directly linked to child safety, an issue of great importance for caregivers. This offers the campaign a lot of advantages in the communication process, such as increased message attention, deep and carefully consideration of the learned information, a strong memory and recall, high consistency between intention and behavior change, among others. And before we finish this section, we should also explore the interest groups in the communication or health risks. Risk communication includes various groups who are potentially at risk or are otherwise interested. We should acknowledge that perception, understanding, and framing of a health risk could be influenced both positively and negatively by powerful interest groups outside the government, including private for-profit corporations and public health campaigning organizations. As scientific information doesn't speak for itself, interest groups can interpret the scientific data and mislead public risk and risk factors perceptions. These interest groups try to influence public opinions as well as new regulations or policies against or for the control and prevention of health risks. Scientific information or non-facts are always subject to interpretation and the social construction of the scientific-based evidence, which widely determines how risks are defined, perceived, framed, and communicated in society. However, scientific uncertainties allow for a variety of different and sometimes distorting interpretations and understandings of the same data set to meet the interests of special groups. This has been found in many industries, such as in the tobacco or alcoholic drinks ones. For example, claiming less harm or reduced risk of disease from using tobacco products can mislead consumers to think that these products are safe to use. Here I show an example that has been created by the US Food and Drug Administration. The fictional ABC cigarette promotion describes their product as light and claims that the filter removes 7 times more tar and nicotine. These claims may be misleading, suggesting a reduced harm. Both of these claims require scientific evidence, and also the approval of the regulatory body is also needed. In contrast, I present here the material of a success campaign against smoking, which prevented in the US close to 600,000 youth aged from 11 to 19 from initiating cigarette smoking in 2 years of the campaign, saving not only thousands of lives, but also billions of dollars for the American society. There are many other examples of misleading messages, such as in the food industry, when they intend to present healthy products that are composed by high levels of sugar or fat. Therefore, special interest groups, whether public or private, or for-profit or not-for-profit, are principally organized, so we should normally assume that these groups will communicate the evidence about health-related risks in such a way to protect their own interests. While industrial interest groups try to minimize messages about the harm of their products, public health interest groups try to search for wider consensus in the population in order to make government risk control policies more acceptable with messages, emphasizing their harm, and then encourage policies and strategies that aim to reduce risk, including better regulation. Public health interest groups have less budget and are less coordinated at national and international levels than industrial groups. However, public health groups are better accountable for the public than corporate or industrial ones. Here, the tobacco or alcoholic drinks industries are very good examples of how their communication campaigns promote consumption while distorting public understanding and perception of the involved health-related risks. And here we close this lecture, so thank you.